Hearing together of the Indian Affairs Committee. This is an oversight hearing on high risk, no reward, GAO's high risk list for Indian programs. Before we get into today's hearing, I want to bring up last week's hearing that turned into a listening session. As the committee is aware, we had witnesses travel from Arizona and Alaska to provide testimony on their respective bills. S 825, Southeast Alaska Regional Health Consortium Land Transfer Act of 2017, and S 772, Amber Alert Indian Country Act of 2017. Since testimony and materials were received at last week's listening session, as no fault of their own, I guess I would be wondering if there's any objection that all testimony and materials from last week's listening session be given the same weight as if the committee held an actual legislative hearing. So I'm asking if there's any objection to that.
No objection.
Okay, good. Hearing no objection, all testimony and materials will be part of the record and given the same weight as a legislative hearing, and I thank you for that. Today, the committee will examine the Government Accountability Office report on its high-risk list, which now includes 3 federal Indian programs. Every 2 years, at the start of a new Congress, the GAO compiles a list of at-risk federal programs. These programs are considered high risk because they are vulnerable to fraud, waste, abuse, or mismanagement. Now, for the first time, 3 Indian issue areas were identified as high risk. These include Indian energy development, education, and healthcare. In fact, the GAO tells us that these high-risk areas have 39 open recommendations that have not been satisfied. These federal programs are vitally important and affect many tribes and individuals across Indian country. These programs affect the safety of school buildings and facilities, the quality of health care and education, and the advancement of Indian energy development projects in Indian country. Over the years, the GAO has done a tremendous job at examining and bringing to light numerous challenges facing these federal Indian programs, and some of these problems are very troubling. For instance, in its 2014 report, the GAO noted that a single audit of a BIE school located in Arizona lost $1.7 million in unaccounted federal funds. Upon further investigation, it was determined this money was illegally transferred to an offshore bank account in Indonesia. The incident was referred to the Department of the Interior Office of Inspector General in July of 2014. The IG then asked for the assistance of the Federal Bureau of Investigation, the FBI. According to the IG, certain bank accounts were hacked, enabling the unauthorized transfer of funds. How could this happen? Who was ultimately responsible for ensuring fraud like this doesn't happen to BIE-funded schools? And at this point, I would ask for the first chart we have, which illustrates various roles of the BIA, BIE, and others, and BIE does in supporting and overseeing BIA school facilities. The chart to my right shows how bureaucratic the BIE has become. For instance, the chart shows the multiple layers of offices that support and oversee BIE school facilities between the BIA, the department, the Deputy Assistant Secretary for Management, and the BIE itself. The lack of oversight and cybersecurity is problematic, but it appears to be only part of the problem. The GAO also issued a 2015 GAO report highlighting additional management challenges in education. Healthcare services also face significant issues. Since 2011, the Government Accountability Office has issued 7 reports on the IHS, Indian Health Services. These reports have related to improving oversight on the quality of care provided to Indian patients, improving the purchased referred care program, examining the enrollment of Indians in health care coverage expansion, and improving patient wait times at IHS facilities. One report found that Indian patients had waited 6 weeks for an initial visit with a family medicine physician. There appeared to be an even longer wait time of 3 to 4 months for an Indian patient to see an internal medicine physician. From data gathered from these 7 reports, the GAO has made 14 recommendations to improve the Indian health services. These recommendations remain open. For one recommendation on staffing, the IHS disagreed and continues to not implement the GAO recommendation. Although the Indian Health Services has acted upon some recommendations, such as adopting Medicare-like rates for non-hospital services and improving data collection for the Purchase Preferred Care program, more needs to be done. Finally, the GAO has confirmed what Indian tribes have experienced about lost opportunities when they want to develop their energy resources. These problems were outlined in the 2015 GAO report, which highlighted poor management and oversight of energy resource and development at the Bureau of Indian Affairs. For instance, in 2016, the GAO found many BIA offices had high vacancy rates for key energy development positions. According to the GAO, some offices reported not having staff with key skills to review energy-related documents. Perhaps this is why one tribe said it took the BIA 8 years to approve right-of-way agreements. This tribe said these delays cost an estimated $95 million in lost revenue. So our next charts illustrate the longer approval process for renewable and oil and gas Indian energy projects versus private lands. These charts show how bureaucratic the approval process is for an Indian tribe to develop their own energy resources. This needs to change. That's why I've introduced S-245, the Indian Tribal Energy Development and Self-Determination Act of 2017. This bill directs the Department of the Interior to provide Indian tribes with technical assistance in planning their energy resource development programs. Legislation cuts red tape and makes it easier for Indian tribes to develop their own resources. It also streamlines the process for approving tribal energy resource agreements and making this process more predictable for Indian tribes. Money made from developing Indian resources, whether it's coal, oil, natural gas, wind, or solar, for example, can have a significant impact on tribal communities. These energy projects can create high-paying jobs and bring revenue to tribal governments. It is unacceptable that the trustee would inhibit and even prevent the tribes from engaging in healthy communities or economic development, whether it's energy or otherwise. Through misplaced or misguided policies, mismanagement, these agencies should be ensuring that their tribes actually have opportunity and that they are thriving and prosperous, not continuing to suffer or miss opportunities. Indian communities deserve better than they are receiving right now. I want to welcome our witnesses today. I look forward to hearing from all of you on these important issues. Before I turn to our witnesses, though, I want to turn to Vice Chairman Udall for his opening statement.